Hello everyone, myself Shivani Nadre and my topic for discussion is drugs for constipation and diarrhea. What is constipation? Constipation means incomplete evacuation of the bowel. Laxative and purgatives are the drugs that promote evacuation of bowel. Laxatives are milder in action. Purgatives have stronger action. Many drugs in low doses act as laxative and in larger doses act as purgatives. Let's see classification of laxatives. Bulk forming agent, stool softener, stimulant purgative and osmotic purgative. Bulk forming agent include dietary fiber bran, psyllium, isfagula, methyl cellulose. Stool softener include Dacusate, liquid paraffin. Stimulant purgative include bisacodyl, sodium picosulfate, Senna, Cascara Sargada, Procalopride and lubiprostone. Osmotic purgative include magnesium sulfate, magnesium hydroxide, sodium sulfate, sodium phosphate, sodium potassium tartarate, lactulose and lactylol. Let's see mechanism of action of purgative and laxatives. All purgative increases the water content of the fecus by osmotic action, retaining water and electrolyte in the intestinal lumen, increase volume of content and make it easily propelled. Acting on intestinal mucosa, decrease net absorption of water and electrolyte, increase propulsive activity as a primary action and allowing less time for absorption of salt and water. Laxative cause fluid accumulation in gut lumen by inhibiting sodium potassium ATPase of villus cell, impairing electrolyte and water absorption. By stimulating adenyl cyclase in crypt cell, increasing water and electrolyte secretion. Enhancing prostaglandin synthesis in mucosa, which increases secretion. Increasing NO synthesis, which enhances secretion and inhibit non-propulsive contraction. Now bulk purgatives. Bulk purgative में dietary fiber bran. Bran is the residual product of flour industry, which consists of 40% of dietary fiber. It absorbs water in the intestine, swell and increases water content of fecus, soften it and facilitate colonic transit. Increased intake of dietary fiber is the most appropriate method for prevention of functional constipation. Bran is generally safe. Now psyllium and isfagula. They contain natural colloidal mucilase which form bulky gelatinous mass by absorbing water. It increases bacterial mass and softens the fecus. It acts in 1 to 3 days and should not be swallowed dry, can cause esophageal infection. Now methyl cellulose. It is a semi-synthetic colloidal hydrophilic derivative of cellulose that remain largely unfermented in colon. Dose 4 to 6 gram per day. Now stimulant purgative. Diphenylmethane. Diphenylmethane include bisacodyl. Bisacodyl administered orally and absorbed in the intestine and excreted in bile to undergo partial enterohepatic circulation. Duration of action is 6 to 8 hours. Side effect skin rashes, fixed drug eruption and Stevens-Johansson syndrome. Sodium picosulfate. Another diphenyl method related to bisacodyl. Now anthraquinone. These are plant products used in traditional medicine for centuries. Senna obtained from leaves and pods of Cassia species and Cascara sargada obtained from powdered bark of buckthorn tree. Duration of action is 6 to 8 hours and taken at bedtime. Side effect skin rashes, fixed drug eruption, chronic atony, and mucosal pigmentation. What are osmotic purgative? These are solutes that are not absorbed in the intestine, retain water osmotically, increase fluidity of stool, and distend the bowel, increasing peristalsis indirectly. Saline purgative are infrequently used now for the treatment of constipation. Lactulose. Lactulose broken down in the colon by the bacteria to osmotically more active and weakly acidic product. Dose 10 to 30 gram and duration of action is 8 to 24 hours. Side effect flatulence, flatus and cramp. Lactylol. It is a disaccharide sugar alcohol similar to lactulose in properties. Neither absorbed nor digested in ileum but get fermented by bacteria into osmotically active and weakly acidic product. Side effect distension, flatulence, cramp, nausea, vomiting. Used for the treatment of constipation and encephalopathy. Let's see some MCQ. Which of the following is not a bulk forming agent? Brand, psyllium, methicellulose, and liquid paraffin. Liquid paraffin. Which of the following prostaglandin analog can be used for the treatment of constipation? Lubiprostone, carboprost, misoprostol, cavoprost. The answer is lubiprostone. Which of the following drug causes degradation of cholesterol in liver? Bran, psyllium, bisacodyl, docusate. Answer is bran. Bran causes degradation of cholesterol in liver. Which of the following is stool softener? Docusate, liquid paraffin. So both are stool softener. Which drug are infrequently used for the treatment of constipation? Anthraquinone, saline purgative, bisacodyl is fabula. So saline purgatives are infrequently used for the treatment of constipation. Thank you.